Dr. Zehra Hooda, and I'm originally from Atlanta, Georgia. I did my undergrad at Emory University, and then I went on to do my medical degree at Philadelphia College of Osteopathic Medicine's Georgia campus, which is in Suwanee, Georgia. So I stayed in the South. I then went to Tampa, Florida to do my neurology residency, and I then did my interventional pain fellowship for a year in Tampa, Florida at University of South Florida. I practiced there for 5 years. After I completed my fellowship, I moved to Houston, Texas, where I married my husband, who is from Houston. And now we're enjoying the city and doing what we love, traveling on the weekends. We like going abroad and traveling to different countries like South Africa, hoping to go to Brazil soon, and doing adventurous things. So an interesting fact about me is on one of my travels in South Africa, we did go shark diving. So we were in actually a cage and went under and saw the great whites, which South Africa is known for. We also did parasailing on that same trip. So adventure is definitely something that I'm interested in. A lot of people ask me why I went into medicine. So when I was younger, I always thought I would be a doctor. I initially thought I'd be a psychiatrist because I loved finding little details about people, talking about their lives. But my mom does have rheumatoid arthritis. So when I was younger, she was in and out of hospitals and in and out of doctor's offices. So I got really used to going and seeing the medical field from a patient perspective instead of a physician perspective. So I got really interested in the medical field, and I really wanted to help patients similar to my mom and similar to those families that really struggle. And I wanted to do what I could for those types of people. So while I was in medical school, I did rotate with an anesthesiologist my 4th year. This was at the end of my 4th year when I had already matched into neurology, and he was a pain physician. So he was actually practicing in a little town in Georgia called Warner Robins, Georgia. Where the population was very small. So he was actually letting me help him with a lot of the procedures, like the medial branch blocks and the epidurals that I'm doing today. He was actually teaching me about it initially, and that's what sparked my interest first. And then when I did neurology, we actually did have an interventional pain fellowship that was under neurology. It was accredited under neurology. So even there I was able to do different procedures. And as a neurology resident, we did a lot of lumbar punctures, and I always liked using my hands. So I knew that pain management would be something that I would be good at and I would like. In neurology, we deal with a lot of headache patients, a lot of low back pain patients, and it's just something that I've grown accustomed to and like dealing with.